In fiscal year 2021, through the Substance Abuse Prevention and Treatment Block Grant Program COVID-19 Supplemental Awards, the Ohio Department of Mental Health and Addiction Services, Ohio University's Voinovich School of Leadership and Public Service, and the Pacific Institute for Research and Evaluation came together to provide support to 5 urban behavioral health boards in Ohio as they engaged in community-based processes to address the impact of social determinants of health when planning for substance use disorder prevention and mental health promotion services and programming. This Community Collective Impact Model for Change 2.0, addressing social determinants of health in minority and underserved communities, was unique because the urban behavioral health boards received phased funding. Project directors began Phase 1 by working to bring together people and groups who had lived experience with health disparities and social determinants of health. Collaboratively and iteratively, community work groups created a data-driven impact statement in Phase 2. From this impact statement, work groups then created 3-year prevention services plans, detailing the goals, objectives, and action steps to be taken to address a specific social determinant of health within an identified priority population as the final initiative phase. The series of videos that follow were created by the communities for the communities and highlight the 3 phases of this initiative through photo voice, ethical photography for social change.
Cuenta sus repeticiones y tiempo cuando corres. Está bien contar calorías, pero la mayoría no contamos nuestras bebidas. Hay poca información sobre cómo tomar decisiones informadas cuando eliges beber. Saber los tamaños estándar de las bebidas puede ayudar a reducir riesgos, pero pocos lo saben. Únete a Envision Partnerships para un curso virtual gratuito sobre cómo reducir riesgos y ganar hasta $125. Las pautas de consumo de alcohol de bajo riesgo pueden ser un gran paso hacia personas y comunidades más saludables. Regístrate hoy.
I'm Father Mike Puckey, a Butler County resident since 2005, a native Ohioan. During these years that I've been in Butler County, I've been there as pastor of St. Julie Billiard Parish. It's a very diverse group of people, diverse age-wise and language-wise and experience-wise and race-wise. Many of our parishioners are Spanish speakers who've been here for maybe some of them over 20 years. Folks who have, over these 20 plus years, made a real contribution to our Butler County community. And I've also, during my years working with them, become quite aware of the fact that many of them have experienced trauma. Folks that have been dealing with addictions, and particularly within the Hispanic community, my experience at least is that the principal substance that troubles our folks is alcohol. It's very typical of folks who are making this transition from one culture to another. So what I'd like to say is that I'm really thrilled that Governor DeWine on several occasions has talked about workforce development. And if it's true that we need more therapists, more counselors for the general population, it's even more true for folks who would be both language and culturally competent. So what is needed, I think, is a real effort to develop people and materials that are both linguistically and culturally competent. But if we find it difficult to find people who are linguistically competent, there's a lot that can be done for our workforce as it is today to help them become more culturally competent. Also, I'd like to see greater access for these folks, many of whom have lived here in Butler County and throughout the state of Ohio for 20 years or more, people who are part of the community as much as any of us, and especially because many of them have been working quite conscientiously on trying to normalize their legal status. Because we have so few culturally and linguistically competent folks that are able to work with our Hispanic population, I really want to emphasize as well the importance of prevention. So prevention in terms of alcohol abuse, but prevention in every sense of the word that can certainly multiply our personnel. Because of that, I really would like to see a real effort to do some better recruitment of folks who are linguistically and culturally competent. That is the gold standard.
The work we've just seen was guided in part by the CDC resource titled Promoting Health Equity, a resource to help communities address social determinants of health, which describes how considering the impact of social determinants of health when planning for prevention services can improve health outcomes and promote health equity across the lifespan. Additionally, the Ohio University and PIRE teams provided training, technical assistance, professional development, and networking opportunities. The results represent a truly community-led initiative focused on actualizing the impact statements to work towards health equity in each community.